Michael, could you tell us a little bit about Orcas and its relationship with the NIH?
Yes, I'd be happy to, Bernie. We actually have been doing business with the NIH for well over 20 years now, and we're especially focused in the behavioral science area and have anywhere from 10 to 15 projects, clinical trials going on at any point in time. So we've enjoyed a very successful record with NIH, and they really like the rigor that we use in our scientific testing.
And so you've been doing testing and research, and you mentioned that you were about to make a big change.
Yes.
And can you tell us how soon is, what about that change?
Yeah.
And how soon is it going to happen?
Well, we are in fact, and the change is happening as we speak. And I was really brought on to the company nearly 2 years ago to help execute a change from being primarily research-driven to now becoming more of a market-driven company. So we're really focused on taking the research that we've done and converting it into products that get used at a very high level with consumers in the healthcare system. So we're very excited about that transformation. And we're beginning to get some good traction in that.
So you're going to be developing new products?
Yes, yes.
Products you can touch?
Yes, you can touch and you know, mobile health applications.
Yes.
And probably experience more than touch. But yes, highly engaging products in the behavioral health area especially that will really help people make behavior changes. We, as a result of a lot of research, have figured out that there are a lot of barriers to behavior change. And so we're really working on that as a particular issue, you know, as a big need in the healthcare system.
Can you explain what kind of behavior you might be looking to change, for example?
Yes.
Or give a couple of examples?
Well, first of all, it's important to note that we're really looking at the whole person. So we're looking at both physical and emotional well-being. And as you may know, there's been a lot of work done on people's physical health, programs to help them improve, but there's been much less by way of behavioral and emotional work. So that's going to be our real differentiator in the market and in the products that we create. So we're really looking, for example, at the issue of depression. We know that it is comorbid with very costly conditions like diabetes and obesity and hypertension and many others. But the depression part is not dealt with very effectively. So our solutions are going to take into account a person's mood and their emotional well-being as well as their physical health. So we're very excited about that, and we have a lot of research and expertise to bring to bear on that problem.
And do you think that kind of data can be aggregated to provide solutions or ideas for other, for a broader population, perhaps?
Yes, yes, because we're actually looking at, okay, you could say, first of all, depression is comorbid in 25 to 50% of the cases with obesity and diabetes. But we're also kind of stepping back from it a little bit and helping a person identify things that will improve their mood and improve their positive feelings and their actions. So we're looking at the prevention of depression as well, and helping people deal with stress and everyday issues, caregiving, which is another big issue. So we're really looking at the whole person when we're looking at this. And looking at preventing the development of more serious depression as well.
And do you see some of the products that you're developing as mobile applications, most of them,
yes,
right?
Actually, we're strictly focused on developing mobile health applications. You know, we, of course, are very bought into the idea of brickless care and the fact that most of us within the coming years are going to access at least 50% of our care outside the traditional walls of medicine. And we think that behavioral health and emotional health are very good areas for this because, you know, a lot of people just don't want to seek out the traditional psychiatric and psychological services for many different reasons. So we're trying to help reduce the stigma around this as well and create a very positive framework for dealing with difficult issues that are preventing change. So.
Well, thank you very much.
Yes, thank you, Bernie. It's been a pleasure.
All right.
Yeah.
Thanks. We're good?
Yeah.
It's a wrap.
Yeah.